it is my pleasure to invite Dr. Francisco Jorge, Director of Public Health in the Ministry of Health in Portugal, Dr. José Tereso, President of Regional Administration for Health, Portugal, Dr. Joe Ivey Boufford, past President of the New York Academy of Medicine and new President of International Society for Urban Health, Dr. José Pedro Paiva, Dean of Faculty of Arts and Humanities at University of Coimbra, Dr. Fernando de Jesus Regateiro, Chairman of the Board of Coimbra Hospital and University Center, and finally, my pleasure, Professor Paula Santana, host and co-chair of this conference. Please give a warm welcome to our distinguished speakers. To start the closing plenary, I would like to first ask Professor Paula to deliver her closing speech. Please, Professor Paula.
Dear Dean of Faculty of Arts and Humanities of the University of Coimbra, Professor José Pedro Paiva, dear Chairman of the Board of Coimbra Hospital and University Center, Professor Fernando Jesus Regateiro, dear President of Regional Administration for Health, Dr. José Tereso, dear Director of Public Health, Dr. Francisco Jorge, dear President of the Society for Urban Health, Joe Boufford, ladies and gentlemen, dear friends, the 14th International Conference on Urban Health is ending. It's my great honor to spend the last 5 days with people from all over the world. I am particularly proud that this was the first time in the history of the International Urban Health Conferences that the event has been held in a small-sized city like Coimbra. As in the past, it were always big urban settlements, just to mention a few: São Francisco, Dhaka, Manchester, Paris, Belo Horizonte. But in fact, almost half of the world's urban dwellers and 56% of Europeans reside in cities similar to Coimbra, where people range between 50,000 to 500,000 inhabitants. It is therefore the right time to emphasize that the potential of small and medium-sized cities must be appreciated and utilized to improve overall urban health, quality of life, and contribute to achieving the Sustainable Development Goals, following the guidance of the new urban agenda. My ambitious goals for this conference was to reinforce the translation of knowledge from multi-sectoral and transdisciplinary research into strong and effective governance, co-synergies with political leadership, committed to improving overall population health and well-being. The challenge of health equity requires joint efforts amongst researchers, frontline practitioners, policymakers, and population. With a holistic understanding of the wide range of urban health determinants and skills and approaches necessary to address them, we can have success. We should be as a team of the orchestra we saw on the stage during the welcome ceremony. I think all you remember. Each member with their individual skills, abilities and roles rehearse their parts of the music to make the whole event happen smoothly and efficiently. As they said, We cannot play a symphony alone. It takes an orchestra to play it. I hope you got stimulated over the last 5 days as much I did. I learned a lot. I experienced a lot. I met wonderful people, inspired and committed to make a change. I feel confident that with such a group, enthusiastic professionals, we are on the right track towards better, cleaner, smarter, and overall healthier cities. With this in mind, I would like to sincerely thank all the distinguished speakers, guests, and participants of this conference for their inspired talks, remarkable insights, and overall contribution to the success of this event. I need the slide. Next slide, please. Is there. This is truly an international conference. Have you any doubts about this? We have attendees from 65 countries, representing 650 delegates. Next one. Until May, we received 1,388 abstracts, plus 7 workshops, plus 29 pre-formed panels from 85 countries. It was, sorry, next one. Previous one. Previous. It was so competitive that we could only accept 30% of abstracts.
Next.
No, not yet. We observed a pattern of topics that were most representing during this conference, namely healthy urban planning, measurement and metrics, data and research, and last one, environment, health and urban sustainability. In fact, this one was the most represented in our abstracts and posters. The topic that requires attention on the agenda is urban governance and equity-oriented policies, in the opposite way. Coming back, my list of people to thank, I would like to express my sincere appreciation for the hard work made by the scientific committee in reviewing more than 1,400 submissions. Next, I would like to express huge appreciation for significant support I have received throughout the conference preparation by Joe Boufford. Joe Boufford, thank you very much from the bottom of my heart. It was a pleasure to collaborate with you. Last but not least, my enormous gratitude goes to all of those who made this event a reality, working from early till late hours. With an ongoing enthusiasm and engagement, and you know. In this occasion, I would like to thank the local organizing team, Adriana Loureiro. Please come. All the team come here, please. Adriana Loureiro. Julia, Angela, Claudette, Cláudia, Eva, Paulo Nossa, Ricardo Almendra, Rui Gama, Teresa Batista, I would like also to call the Elsevier team. Richard Hart, unfortunately, is not with us because Mom is a very serious health problem. Amy Hill is here. Amy Hill. Naya, Deirdre. Applause. And ISU team. Chiara, where is Chiara? Chiara? Where? Oh, he lives. Okay, but applause. And last but not least, our 26 voluntary students. I ask, please, Ana Filipa, Daniela, Gabriela, Anastácia, Bárbara, Ana Beatriz, Inês Margarida, Inês Moreira, all come, please. Maria Santos, Maria Matos, Mariana, Marta, Nuno Marques, Nuno Alexandrino, Oliana, Rui, Sofia, Vanessa, Vera, Inês, Beatriz, Maria João, Marília, Juliana, Sara. There are three things to do in life, certainly. Plant a tree, have a child, and write a book. I can contribute now to the first one. I want you to plant this tree and always remember this conference. And your contribution made it a wonderful event. Applause for them. Okay, you can stay, you can sit. We'll continue. Before closing, I would like to encourage you to take advantage of supporting publication initiative and submit your full paper to one of the following journals showed on the screen, indicating that your paper was presented at this conference, and so editors will review for quality and suitability, and hopefully a significant number of papers will be published as an outcome of this conference. For more information, please contact Deirdre in this slide. Happy hours are always so short, and I hope this international conference on urban health held in Coimbra will have an unforgettable impression on all the participants. I hope that all experts from different sectors presented at this conference could enhance friendship and strengthen cooperation so that we can make joint efforts and pushing forward the sustainable development for healthier cities and urbanization. Thank you very much.
Thank you very much, Professor Paula Santana, for your remarkable speech. Next, may I ask Dr. José Pedro Paiva to deliver his closing speech.
Good morning, all. Let me address you some words in an informal way. First, to stress that it's for me a great pleasure and honor to be here in the closing ceremony of this Urban Health Conference and to welcome all the distinguished scholars that from all over the world, as have been shown by my predecessor, come to attend this conference in Coimbra. Professor Ana Paula Santana, on her closing speech, stressed that Coimbra is a very small town. Yes, indeed, as you have noticed, Coimbra is a very small town, but I think it is a big town in culture and history. I'm sure that you all know that Coimbra University was awarded some years ago by UNESCO the World Heritage Seal. We are a university that was founded in 1290, and I think that institutions with this long story only manage to survive if, all over centuries, they are able to continuously break down the borders of knowledge and transfer that knowledge to society. And we did that in Coimbra due to the cooperation of all the students, all the teachers, and in moments like this, in conferences held that put together people from different parts of the world with different perspectives that put his efforts together in order to change the way we can see the world and interpret the world. I guess that you all have noticed that during these 4 days of the conference, we had very nice weather in Coimbra. This is also a characteristic of our organizations. When we organize this kind of conferences in Coimbra University, we always have this nice weather to welcome our guests. So I hope you have enjoyed your stay in Coimbra, and I'm looking forward to see you again here. Okay, thank you.
Thank you very much, Dr. Paiva, for your speech. Next, may I ask Dr. Fernando de Jesus Regateiro to deliver his closing speech.
Thank you. Good morning to everyone. On behalf of Coimbra Hospital and Universitary Center, and as its chairman of the board, and on myself, I would like to extend a warm congratulations to the steering committee represented by Professor Paula Santana, and to all of you present in this closing ceremony for this wonderful 14th International Conference on Urban Health Equity. That's a pleasure to be here with you. Key pillar themes on a new urban agenda and sustainable development goals were worked out in this conference, pointing to nowadays cutting-edge global challenges raised by deep epidemiological, demographic, and societal changes. And to overcome these changes, we namely need people like you, like us, committed to the practice of altruism and respect. People who respect human diversity and human differences as values in themselves, and who understand that differences do not hurt, but on the contrary, they accrue something to me, to the other, they make an individual richer. Only the respect for differences will allow setting up and work out new integrated and multicultural agendas, to joining different cultures and values, to fighting against exclusion and achieving higher level of economic and social development. And an additional challenge will be the vision and setting up of a new education as, once more, a value on itself and the key pillar of liberty when focused on the humanization of the human relationship against jungles, mainly the urban jungles. Thus, so urban, so local, so universal is an additional challenge. And always the challenges raised by the new policies to sustain health education and the education for a rational using of health resources, improving health access, assuring health equity. Let me also take this opportunity and to attain the end of my speech, let me also take this opportunity to have an additional pleasure just to announce to all of you the World Health Summit regional meeting by April 2018, arriving in Coimbra, just in this venue, San Francisco Conference Center. Then, more than 600 people are also expected to be present, as in this conference, coming from all over the world of M8 Alliance of Academic Health Center, universities, and national academies. Some of the main topics of this meeting will fit quite well with the goals of this 14th International Conference on Urban Health Equity, as they are managing infectious diseases in developing countries, global policies for health coverage in low-income countries, opportunities and challenges in translating innovation to healthcare, and biomedical education for a changing world. Everyone will be welcome. Have a nice returning to your places, and thank you for your attention.
Thank you very much, Dr. Fernando, for your closing speech. And next, may I ask Dr. José Tereso to deliver his closing speech.
Professor Paula Santana, distinguished co-chair of this conference, distinguished Director-General of Health of the Minister of Health, and most illustrious colleague, Dr. Francisco Jorge, my dear friend. Illustrious President of New York Academy of Medicine, Dr. Joe Ivey, Boufford, most distinguished MD colleague. Professor José Pedro Paiva, distinguished Dean of the Faculty of Arts and Humanities of the University of Coimbra. Professor Dr. Fernando Regateiro, distinguished Chairman of the Board of the Coimbra University Hospital Center and full Professor of the Faculty of Medicine. Gentle guests and dear participants, ladies and gentlemen, Coimbra has been hosting during the last 4 days this international conference on urban health. As representative of regional branch of the Ministry of Health, it is a pleasure and a privilege to attend to this ceremony. Professor Paula Santana, thank you very much for your kind invitation. As a public health physician, I am fully aware of the importance of cities as health promotion settings. Since 2007, half of the world population lives in cities. By 2050, that proportion is expected to increase to 66%, with almost 90% of this increase concentrated in Asia and Africa. That's the reason why the World Health Organization dedicated the 2010 World Health Day to urban health. Urbanization emerged more than 6,000 years ago in Mesopotamia. Along with the first cities, social organization and new threats to human health emerged. The rise of cities brought about the spread on infection disease. So, public health is genetically linked to urban health. During most of the existence, cities accept as magnet for disease. Crowded, filthy and violent urban areas promoted illness instead and promotion health. Early 19th century cities of Europe and North America were an appalling example of social and environmental determination of health. Sickness was endemic amongst poor people, and brickets were a constant menace to populations. The challenge we are facing today is to turn cities into healthy cities. As I speak, millions of persons dwell in slums in megacities located in developing countries. By planning properly cities and by offering healthy settings within cities, we promote global health, as most of the worldwide population resides in urban areas. This close ceremony includes reflection of main conclusion of this conference, held in a city founded more than 2,000 years ago. Coimbra, former capital Portugal, former. Coimbra is the capital. Sits the oldest Portuguese speaking university established in 1290. It also sits the biggest national health service, Coimbra Hospital. The Coimbra University Hospital Center is the biggest in Portugal. Is the biggest in Portugal. The Regional Health Administration of Central Portugal congratulates the organization of this conference for the brilliant outcome. I address my compliments to the distinguished co-chairs of this closing ceremony and the best wish to you all attending to this section of a pleasant and a safe return to your homes. Thank you very much.
Thank you very much, Dr. José, for your closing speech. Next, may I ask Dr. Francisco George to deliver his closing speech.
Thank you very much for giving me the floor. First of all, I wish a good afternoon to everyone. And Joe, let me, and Paula, of course, but let me thank for this exercise, for this meeting. The results will be very useful for us. As you know, we are facing a huge NCDs epidemic. Cancer, stroke, and heart attack are the most important problems within this major problem, NCDs, the chronic diseases. We are very much concerned regarding the lack of healthy lifestyles. This is the most important for the moment for us, is be sure that our people have access and understand this way of healthy lifestyles. Healthy lifestyles, as you can imagine, is part of urban healthy as well. And health equity, since we are now involved, committed to reduce inequities. Health inequities are, for the moment, our major goal, reduce health inequities. Our politics, health politics, is based on the reduction of the premature mortality before 70 years old. For this purpose, we should reduce the burden of disease, and the burden of disease before 70 years old, as I said, is a problem of chronic diseases. For this reduction, we should improve the exercise, the diet, of course, but the exercise at urban level. And there is a need to improve the way to improve exercise for children, for adolescents, for adults, for workers, for students. There is a need for new cycles way, and the architects, they should think on this, and the local mayor should guarantee that these new cycle ways, they should be safe. So there is a need to improve the urban agenda, the new urban agenda, and as Director-General for Health, I'm the Chief Medical Officer, I wish that these results of your workshop, your conference, your meeting, they will be implemented, not only in Coimbra, and everywhere. There is a need everywhere at global level. So let me thank once more the invitation. Thank you very much, Joe and Paula, colleagues, students, Coimbra. Coimbra is a very nice town, city, as you can see in the afternoon. Enjoy the river Mondego, enjoy Coimbra, enjoy the weather, enjoy our people, and thank you very much once more. Thank you.
Thank you very much, Dr. Francisco George, for your closing speech. And finally, it is my pleasure to ask Dr. Ivey Boufford to deliver her closing remarks.
Thank you very much. I want to thank all of you for joining us here, and especially those of you who've gathered in, I think, what is a good closing community for this wonderful ceremony. I also want to acknowledge the health leadership and the university leadership that have been so important and supportive in this meeting. I want to begin my remarks by acknowledging my colleague Shamim Talukder from Dhaka, Bangladesh. I think those of you that were with us from the beginning of this meeting saw his virtual greetings. He has been, I wanted to pay tribute especially to his leadership as president of ISUH between 2015 and 2017, the last 2 years. He has been very committed to see this organization get more active, to become more engaged with communities, and to really deal with how we can bring together our community of NGOs, of academics, of government officials to be strong advocates, especially for the urban poor. And so I want to perhaps ask you all to clap for him, applaud for him in absentia for his contribution. I'd like to reflect for a few minutes on the evolution of the International Society for Urban Health, which I think in many ways parallels the development of our understanding of the factors influencing the health of people in cities and our, if you will, definition of urban health. The society was founded in 2002 through the leadership of the New York Academy of Medicine, which continues to be its secretariat. And at the beginning, it was a group of academic researchers convening to explore the challenges of health in cities. And I think in the early meetings, most of the presentations really reflected, at that time, a fairly limited definition of urban health. People were kind of poking around at this thing of cities and what's going on here that's keeping people healthy or putting them at risk. And many of the early presentations at meetings like this were on healthcare for poor people. That's what the public really thinks of when they think of urban health. Then we moved on to dealing with issues of HIV and stress and substance use. And as the MDGs proceeded, we began to deal with more of the special populations and the issues of poverty reduction in cities. So this definition really expanded, and as it expanded, we began to see individuals from more disciplines starting to join the meeting. And the first group that I think bravely perhaps joined all these health professionals and epidemiologists were the urban planners, and then shortly afterwards followed by a number of individuals in disciplines around energy, around housing, transportation, economic development, and others. There have been 2 or 3 watersheds in the history of this organization which I think have allowed us to be what we are today. One was in 2009 when Alex Azay, who was at the time director of APHRC in Nairobi, Kenya, hosted our meeting and did something very different. He had a pre-conference workshop inviting mayors and officials in transportation policy for around Africa and the Middle East to join us for a day and really began this notion of having a track with policymakers, engaging with the academics and the scholars that were there. The second precedent that was set in Nairobi was a direct engagement with the community. Because of Alex and APHRC's work with the slums of Nairobi over at least 2 decades, there was a level of trust and engagement with the community that allowed us to visit, to go and meet people, and then to have them come and address the meeting in a very different way. And I think he established the theme of, yes, we are, it sort of answers Lydia's question, yes, we are about evidence, but we're also about evidence for action, and I think we've kept that theme from the beginning. From that point on. 2011 in Brazil, Waleska Chafa, who is here, hosted us in Minas Gerais, and again, another deep opportunity to work with community, but also at that time a government in Brazil very committed to community engagement, primary care, and outreach. Arpana Verma at the University of Manchester hosted us in 2014, and I think this was the first time we turned the corner, having individuals from areas like environment, climate change. We beamed Yongguan in from Xiamen, climate scientists, housing, engineering, and others, and joining the more traditional disciplines. And then in Dhaka, that mix was sustained in 2015. Shamim Talukder and Eminence hosted us. And again, very large engagement, really for the first time, with large numbers of individuals from the region of South Asia. And I think the large number of individuals here from India, from Bangladesh, from Sri Lanka reflect the location of the meeting in that region. And finally, in Portugal in 2017, and again, this enormous themes that have developed that I think have been so strong in the last week. The belief in the positive opportunities of cities, the commitment to interdisciplinary scholarship, the commitment to community engagement, and to evidence to policy for action across the broad determinants of health, and the commitment to addressing inequities. And we have a real opportunity now with the SDGs, Sustainable Development Goals, Goal 11, an urban goal for the first time ever, happening at the same time as the UN Habitat Agenda, new new urban agenda document. And we're all here because we understand the important role that cities are playing and will play in achieving these goals for urban health and for cities of the future. And our charge is to get these two words together, urban health, by bringing the urbanists and the health professionals together in constant dialogue and mutual learning. So I think the best way of summarize what we've experienced from the last few days are things I've eavesdropped on people saying during the meeting. And as Paula said earlier, of 640 delegates from 63 countries. And I'd add that we had 40% of our delegates are from low and middle income countries, which I think is quite an accomplishment, and again, a sign of the commitment of this organization. So some of the fun quotes that I've heard from people is things like, I've never been to a meeting with such a diverse representation from countries and regions. I've never experienced such easy conversations across disciplines and sectors, and also among academics and government officials and community organizations. I've never experienced such energy in a meeting for the entire time of the meeting, and I've never been to a meeting where there are so many young people. And then it was absolutely fantastic. And then I think the most important thing, and it's representative by this room, I've never experienced such a sense of community of support for advancing urban health. People are eager to talk to each other, to critique each other's work, to engage with each other, and that is a very atypical experience of mine, as in this was an academic I was eavesdropping on. So I think we should congratulate ourselves for those accomplishments, and it's a theme that we certainly know will continue in the future meetings of this organization. And the reason why I think this has happened is it's very obvious that we need each other to solve the problems of creating healthy cities and creating health for individuals in cities. So as I said, it's a critical time for us, and to speak more specifically for our organization, because of our partnership with Elsevier, we are really able to move beyond this conference, which is a global convening and will continue to be at the core of our work, but to increasingly serve as a global resource on urban health to our members and also to the broader urban community of research, education, policy, and practice. And thanks to all of your support, and we hope many of you will in fact join us as members or continue to join us as members of our community. We're very enthusiastic and excited and look forward to getting all your ideas about the strategies we should promote. So let me just very briefly introduce and thank those who have been important to our development up to now. I want to acknowledge first Dr. Yonette Thomas, who's a sign of our brave new world here, is going to be our executive director for ISUH. Yonette, would you stand up so people know who you are and they can find you later? I also want to thank Arpana Verma from the University of Manchester. I haven't seen her this morning. She may still be here. And Dr. Tony Capon, who is now the chair of planetary health at the University of Sydney School of Public Health, who are board members rotating off of our board. And acknowledge also Dr. Blaise Nguendo Yongsi, who's the president-elect of the International Society from Cameroon. Blaise, I saw you in the back. Would you stand up? Dr. Gerard Salem, who's our Secretary-Treasurer from France. Haven't seen him this morning. Continuing board members, Jeannie Birch, I know who had to leave, Susan Thompson and Jean-Christophe Fatso, who were not able to be here, but also to present to you your new board members, some of whom are here. I know Jason Corbin from Berkeley in the USA, Gina Lavasi from Drexel University in Philadelphia, USA, Saneth Banerjee from India, Blessing Mberu from Africa, Kenya, Leila McKay from the United Kingdom, Olga Sarmiento from Colombia, and Rajai Al-Awad from Morocco. So I'd like to invite those individuals to stand, and we have a number of our former emeritus board members here. So if they would stand so that we could acknowledge their contribution to this organization. Thank you. So finally, as I take the baton from my virtual colleague, Shamim, I'm very excited and honored to be president of ISUH for the next 2 years and to work with Dr. Thomas and my colleagues on the board to assure that we continue to be very effective providers of evidence and education and advocacy for urban health. And I'm very pleased at this point to announce that our International Conference for Urban Health in 2018 will be held in Kampala, Uganda in November. And we're being hosted by the Ugandan National Academy of Sciences in partnership with the Network of African Academies of Science. So that's an exciting opportunity to bring in our other scientific partners in addition to ICSU to that event. And then because they're here, I'd like also to announce that our 2019 International Conference will be held in Shamim, China, hosted by Dr. Yong Guanzhu and Dr. Franz Gatzweiler. So let me again add my thanks for the scientific committee, very, very hard work and very excellent work, as you could see by the quality of this meeting, the host committee, the University of Coimbra and Coimbra City and health officials and national health officials, and last but of course not least to Dr. Paula Santana, and she's giving away trees and pots of orchids, so I feel guilty, but I'm going to give her some roses anyway, so. Thank you very much, and I look forward to working with all of you and hearing from many of you over the next weeks and months. And see you next year in Kampala.
Thank you for attending the conference. It was my pleasure to host you. By these words, I am announcing the 14th International Conference on Urban Health is closed. Have a safe way back to home. Thank you very much.